Hello. I would like to talk with you today about cognitive behavioral therapy. Cognitive behavioral therapy is a very important set of tools that help people to learn techniques to handle difficult life situations, both internal and external. We know that life presents difficulties, and we need to learn tools to know how to handle these difficulties. I'm a big fan of the ancient Chinese saying that we all know. I'm going to do it for you in ancient Chinese. Shou ran yu yu buru shou ran yu yu, which means give a person to fish, they'll eat for a day, teach a person to fish, and they'll eat for a lifetime. So when we do cognitive behavioral therapy with people, we want people to learn how to use techniques that will help them not just in their present situation, but in all situations that they may face throughout their life. One of the things that we know is that how we look at things determines a lot how we feel. Epictetus, the great philosopher, said, "People are concerned not so much by events as by the views which they take of them." Shakespeare said, "Things are neither good or bad, but thinking makes them so." Bobby Jones, the golfer, said, "Golf is a game played on a 5-inch course, the distance between our ears." So we know looking at things the correct way can really help us a lot. We call this having the right view. How do we find this right view? Well, to begin with, let's understand what cognitive behavioral therapy is. CBT, as it's called, is actually a unification of behavior therapy and cognitive therapy. Behavior therapy started with the principles of what's called classical and operant conditioning. Conditioning uses what we call reinforcements. Cognitive therapy adds the component of how we think about emotions and behavior. Classical and operant conditioning were developed by two people from our ancient past in the early part of the 20th century and middle 20th century. We have Pavlov and B.F. Skinner. Pavlov, of course, had his famous experiment with the dogs where he would present food to the dogs and then couple that food presentation with a bell. And then he would just ring the bell and he would notice that the dogs would salivate. This is a very famous experiment that talks about how we can become conditioned by things. In operant conditioning, Skinner realized that humans, particularly, but animals as well, can be modified in their behavior by using different forms of reinforcement. Positive reinforcement are things that we use to help people increase the intensity or frequency of a behavior. Extinction is the opposite. Extinction is when we try to decrease a certain behavior, usually by first ignoring the behavior so that it goes away. Negative reinforcement is kind of a use of a threat, saying to the person, something bad will happen if you don't stop this behavior. And rewards and punishments are not technically reinforcements, but we use them that way sometimes, where we'll give someone a reward for something after they've done a good behavior, or if they've done a behavior that's troublesome, they may receive some form of punishment. There are many different levels of detail that we can go into in reinforcement theory, like sometimes we combine positive reinforcement with extinction, or we combine extinction and negative reinforcement, so we can use what is called differential reinforcement, where we try to ignore a behavior and try to reinforce the behavior that we do want and ignore the behavior that we don't want. Cognitive therapy focuses on the use of specific protocols that have been found through research to be effective with depression, anxiety, pain, personality disorders. One of the things that's very important to know about cognitive therapy is that their forms of treatment, the protocols that are used, are different for the different disorders. In earlier times, people would use one method of doing therapy. They would be empathic and they would listen well. And if a person had depression, that's what they did. They showed empathy and they listened well. And if a person was anxious, they listened well and they were empathic. And if they had obsessive compulsive disorder, they listened well and they were empathic over and over and over again. We know that empathy and listening well is important, but we also know that people need to learn skills. So there are specific types of skills that are used for depression, different types of skills that are used for the different anxiety disorders. We don't treat phobias the same as we would treat panic. We don't treat panic the same as the way that we would treat OCD. We don't treat PTSD the same way. Each one of them has a separate protocol, step by step, with different tools that we use to help people. The person who pioneered these protocols and an understanding of cognitive therapy was named Aaron Beck. We call him Tim Beck. That's the name that he goes by. Very important person in our field. For some people, we believe that Beck is important to the 21st century, late 20th century, early 21st century, as Freud was. This could very well be true. Only history will tell. Beck and many others, they came up with a new behavioral and cognitive strategy to help people using what's called a behavioral analysis of a problem. And this behavioral analysis became the new standard. It was called a case conceptualization. This is how we would understand a problem rather than just assigning this specific protocol for this specific problem. We'd have to customize it for each person, just in the same way in medicine. When a person comes in with an illness, we can't just throw a medicine at it. We have to know the particular person, the other conditions that they have, their body, and all of those kinds of things. So we need to customize these techniques for each person. So this conceptualization meant that we would try to understand what situation they were living in. What kind of thoughts do they have? What kind of feelings are they experiencing, both bodily, which we call somatic, and emotional moods? And what behaviors do they do? And importantly, what kind of results are they getting from this? And regarding their thoughts, what kind of conditional beliefs do they have about what do they imagine or expect is going to happen when they're thinking a certain way? And where do these beliefs come from? Their core beliefs that come from their early childhood, perhaps. So one of the people who pioneered a conceptualization model, Christine Badescu, who is the person that I studied with in California, and during the 1990s, every other year I would go out to Palm Springs, and we would study together in a place called Camp Cognitive Therapy, and we learned together. It was a wonderful experience with Christine and with Kathleen and all of the other members of our group. We understood that people have a current environment and that their physical reactions, their moods and feelings, their behaviors and their thoughts all interact with each other. It was an interactional model, and we needed to learn how all of them fit together. So as we explore this more together, hopefully we will get to see how we can use some of these tools in the next part of our exploration together. Thank you very much. I look forward to talking with you more.